Yes.
Hi, my name is Madison and I'll be your nurse today.
Hi.
Can you please state your name and date of birth?
Jessica Martino, 4171.
Great, everything matches the records. So today we're going to do a head-to-toe assessment for your physical, your yearly physical. Has anything changed since the last time you came?
No.
Are you taking any medications?
Yes.
What medications?
I'm trying to quit smoking. It's called Wellbutrin.
Okay, do you have any allergies?
Not that I know of.
Okay. So I'm going to close the door for privacy. There are no contact precautions for your room. And we're going to start with your vital signs. So first I would check your temperature with an oral thermometer. I would stick it under your tongue and you would close your mouth tightly, and then I would wait for the temperature to pop up. Normal temperature is 98.6. I don't have an oral thermometer. Next I'm going to check the pulse in your radial arteries. Okay, 35 beats in 30 seconds, so your pulse is 70 beats per minute. It is strong and regular. I'm just going to check it in your other wrist as well. All right, your pulse is the same in your other wrist, strong and regular, 70 beats per minute. Next, I would check your blood pressure using a sphygmomanometer. Unfortunately, we don't have a cuff. So what I would do is I would find your brachial artery, and once I found it, I would put my stethoscope over it to listen for it. I would then attach the cuff to the upper arm, and I would inflate the cuff until I couldn't hear the pulse any longer. And then at that point, I would inflate it another 30 millimeters of mercury, and then I would slowly let the air out of the cuff. The first pulse that I hear is the systolic pressure, and then the last one I hear is the diastolic pressure, and a normal blood pressure would be 120/80. Now I'm going to measure the respiratory rate. I typically would not tell the patient I'm doing a respiratory rate so that they don't know that I'm counting their breaths, but I'm going to count her respirations. All right, so I watched her respirations for a minute, and she had 19 respirations per minute. And just to go over her general appearance, she is not showing any signs of anxiety. Her hygiene is well groomed. Her body positioning seems comfortable, and her speech is articulated properly. No slurring of words, and mobility seems good. Next, I'm going to go over skin, hair, and nails. So I'm just going to inspect your body for any lesions, bruising, or rashing. Okay, and as I go down, I'm just going to inspect the temperature of your skin. It is cool to the touch and equal bilaterally. The color is a light pink tan color. No signs of lesions or bruising. I'm just going to inspect now for edema and your pressure areas. So, so there's no signs of edema in the lower legs or in the arms and her pressure areas. I'm just going to check her heels. There's no ulcers. I'm just going to ask you to sit forward as I check your coccyx. Okay, no ulcer. And just your shoulder blades. Pressure areas, there are no signs of ulcers. Next, I'm just going to go over your scalp and your nails. So, do you mind if I touch your hair?
No, you need to take my glasses off.
No, they're okay. So I'm just checking your scalp for any bugs, lesions, lumps, bumps. No sign of the following. And then I'm just going to check your capillary refill. And it refills in less than 2 seconds. Now I'm going to do a little head and neck inspection. So for your eyes, I'm going to check for drainage and pupillary relaxation to light using my light. So just checking the drainage. No excessive drainage, and I'm just going to shine this light in your eye to check your pupillary reflexes. Okay. So before dilation, her pupils were approximately 5 millimeters. Then after, they dilated to 3 millimeters. Next, I'm going to inspect the mouth, tongue, and teeth for moisture, color, and facial symmetry. So just open your mouth, say ah.
Ah.
Okay, color is pink, moist, and no dentures. And facial symmetry, can you smile, puff your cheeks, stick out your tongue, raise your eyebrows. All right, face is symmetric. Next, I'm going to go to the chest. So I'm just going to inspect the expansion and retraction of your chest wall. She has no accessory muscle use. And now I'm going to check jugular distension with my light. So I'm just going to lay you supine, so if you can just lay on your back.
Sorry.
And I'm going to have you turn your neck to the left side. And I'm going to find the sternocleidomastoid muscle and the jugular. And in between there is where you would find the jugular vein. And there's no distension of the vein. Okay. Next, I'm going to auscultate your breath sounds anteriorly and posteriorly. So I'm going to begin listening at the apices, which is C7, the base of the neck. Can you sit up? And as I do this, I'm going side to side in a Z formation to check the lungs bilaterally. All the way down to the bases of the lungs. Deep breath. I'm going to check posteriorly. Breathe in. Okay. Vesicular lung sounds are clear to oscillation in bilateral lung fields. And now I'm gonna find the apical pulse. So to find the apical pulse, it's in the 5th intercostal at the midclavicular line. So midclavicular line at the 5th intercostal. And I'm going to calculate the apical pulse. After listening for a minute, her apical pulse was 72 beats per minute. And I'm going to check for symmetrical lung expansion by palpating in the back. Using my hands, I'm going to see how far my thumbs move away from each other as she inhales. Okay, deep breath. And again. Lung expansion is symmetrical. Onto the heart. I'm gonna identify S1 and S2. So I'm going to find it at the midclavicular line in the 2nd intercostal left and right. Moving on to the extremities. I'm going to inspect arms and legs for pain, deformity, edema, and compare them bilaterally. So,
Thank you.
do you have any pain in your arms or legs?
No.
No edema, no bruising, and they're symmetrical bilaterally. I'm gonna palpate your pedal pulses on your dorsalis pedis and your posterior tibial. Can you lay back for me?
Mm-hmm.
Okay, 32 beats per 30 seconds. So 64 beats per minute in the dorsalis pedis. And then around the back, I'm going to check your tibial. 34 beats per 30 seconds, so 68 beats per minute, and the pulses are symmetric bilaterally. I'm unable to check her capillary refill on her toes because of her nail polish, and before in her vitals, I checked her capillary refill and it was less than 2 seconds. I'm going to assess your hand grip and strength, so can you just squeeze my fingers as hard as you can? Okay, it's equal and strong. I'm gonna check your dorsiflex, plantar flex. Can you push down like you're driving a car? And up. Okay, resistance is strong and equal. There's no edema to lower legs and feet, and there's no presence of distended veins. I'm gonna check your calves first. Do you have any calf pain?
No.
Calf size is equal. Bilaterally, no signs of pain or DVT. And I checked skin integrity, pressure areas before. There was no skin ulcers on her coccyx, heels, or shoulder blades. Next, I'm going to check your neurological system. After observing the patient throughout the assessment, her appearance is well groomed, attitude is positive, her behavior, mood, and affect is happy and positive. She's not asking any questions that show any type of mental illness. So I'm going to do a mini mental state examination. So I'm just going to say 3 words, and you're going to repeat them back to me, and then I'm going to continue the assessment. I'm going to ask you what those 3 words are later on. Okay.
I'm not really good with memory, but go ahead.
Pillow, phone, and dog.
Pillow, phone, and dog.
Okay. Do you know where you are?
Yes.
Where are you?
At the doctor's office getting a physical.
What's the date?
May 11th, 10th,
11.
May 11th.
Do you know who the president is?
Yes, President Trump.
Okay. And what were those 3 words?
Pillow and dog. Pillow, phone, and dog.
Good.
Sorry.
Next, I'm going to assess your 12 cranial nerves. So cranial nerve 1, olfactory. I'm going to check your smell. So what I did is I put a little bit of hand sanitizer on a napkin. I'm going to check her olfactory nerve that way. So just tell me if you can smell it. Can you smell
Yes.
in both nostrils? Okay. Cranial nerve 2, I'm going to use confrontation. So you can sit up for that. So you're going to look at this sign over here. And then I'm going to put your phone in front of your face. So I want you to look at the sign and look at your phone. Sign, phone. Okay. And the ocular fundus is pink. Size is 5 millimeters, and onto cranial nerves 3, 4, and 5. The ocular motor, trochlear, and abducens nerves. So I'm going to check the pupil for size, equality, and light reaction, and positions of gaze, and if there's any nystagmus. So again, I'm going to use the light to check your pupils. Pupils are reacting to light. There was no nystagmus, and her gaze, she did not go into a gaze. Trigeminal nerve, I'm going to check mastication. Bite down and release. Bite down and release. Her masseter muscles are strong. Next, the facial nerve. So, can you smile? Frown, close eyes tightly, lift your eyebrows, show your teeth, and puff your cheeks. Good. Next is the acoustic nerve. I'm just going to do a whispered voice test. You're going to repeat back to me what I whisper.
486.
You don't have to whisper it back. And your left ear.
598.
Good. Glossopharyngeal and vagus nerves. I would depress the tongue. I don't have a tongue depressor. As the patient says, ah, and for the vagus nerve, the voice is smooth and not strained. Next, the spinal accessory nerve. So, can you turn your head towards my hand? The other way. And shrug your shoulders. Good. And then cranial nerve 12, hypoglossal nerve. Can you stick out your tongue? Okay, there's no wasting or tremors. And lingual speech is clear and distinct. Using the Glasgow Coma Scale, her neurological function is mild because her eye opening is spontaneous, her verbal response is oriented, and her motor responses obey commands. Moving on to musculoskeletal. I would check the patient information prior to assessment of activity order, mobility status, falls risk, and need for assistive devices. Do you have any pain?
No.
Do you use any assistive devices at home?
No.
Do you have a history of falling?
No.
Just asking. Do you have any history of arthritis, joint problems, or medications related to your bones or muscles?
Family history or just me?
You.
No.
And family history?
Yes.
Can you tell me more about your family history of falls?
Well, not falling, arthritis.
Okay. Okay. Let's pick probably test muscle strength. Can you assess your hand grip strength again? Squeeze tight. Good. And resistance. Can you put your shoulders up? And sideways. Sideways. And touch your ear to your elbow. Touch your ear to your shoulder.
I was gonna say that. My body doesn't go that way.
Push your legs back and forward, and push your knees up against my hands. Okay, and your feet push down and push them up. Good. Muscle strength is equal bilaterally. I'm just gonna check your range of motion.
I need to see you.
Wrists, can they supinate and pronate? Supinate, pronate.
Supinate, pronate.
And your elbows, expand and retract, extend, and yeah. And your shoulders, full range of motion, good. And your ankles, plantar, dorsiflex, good. And your knees, other knee, good. Client able to sit up, so can you stand? And can you walk? Patient has the ability to walk. Her gait is normal, and she's steady. And she seems comfortable walking. And last minute, inspect the abdomen. So you can sit down and lay down. I I would first inspect the abdomen for any distension. Profile is flat to rounded. Abdomen is symmetric bilaterally with no bulging or visible masses. There's no pulsation or movement of the abdomen, and the patient appears comfortable and relaxed. Next, I'm going to oscillate vowel sounds, beginning in right lower quadrant. Vowel sounds are present. High-pitched gurgling in all 4 quadrants. Next, I'm going to palpate the 4 quadrants with 4 fingers to press about 1 centimeter. Please let me know if there's any pain or pressure. Pain or pressure? Okay. And there's no bladder or bowel distension. I'm just going to ask you some questions about your urine and bowel output. How often are you urinating?
About 15 times a day.
Okay. What's the color?
Normally clear, but I've been taking B12, so it's like a yellow now.
Is there any weird odor, or is it normal?
No odor.
Okay, and how often are you having bowel movements?
2 times a day.
And are they solid?
Yes.
Okay. Do you have any questions for me?
No.